broadly speaking, our proposed baseline level, what we have called level 0, is the closest to normality that we think we can safely get to without more effective treatments for COVID or a vaccine against COVID. And remember, we are hopeful for both of these developments in the months ahead. Level 0 is broadly comparable to the position we reached in August when the virus was very suppressed in Scotland, but still a threat. At this level, we would be able to meet indoors with 8 people from 3 households, and most businesses would be open, albeit with safety measures in place. Level 1 sees slightly more restrictions. For example, indoor household meetings would reduce to 6 people from 2 households, but there would still be a reasonable degree of normality overall. And I would describe that as broadly similar to the situation we were at in Scotland around mid-September, as cases started to rise again, but prevalence was still fairly low. Now, getting back to level 1 and then to level 0 and being able to stay there is what we are aiming for this side of better treatment or a vaccine. However, levels 2 and 3 are intended to apply at times such as now, when transmission is higher and rising. Level 2 entails restrictions broadly similar to those currently in place just now outside the central belt, so limitations on hospitality and no gatherings inside people's homes. And level 3 is broadly similar to the tougher restrictions which currently apply across the central belt, with much of hospitality being closed completely. There are, however, some key differences. For example, we envisage restaurants being able to open at least partially in level 3. Levels 2 and 3 are intended to apply, if necessary, for relatively short periods of time to bring transmission down and under control. And finally, level 4, the highest level, which of course we would not use unless absolutely necessary, would apply when transmission rates are or are threatening to become very high, with corresponding pressure on the NHS and perhaps the risk of the NHS being overwhelmed. The restrictions at level 4 are closer to a full lockdown. For example, non-essential shops would have to close at level 4. However, even under level 4 restrictions, 6 people from up to 2 households could still meet outdoors. There would be no limit on outdoor exercise for individuals, and we would seek to keep manufacturing and construction businesses open, albeit with safety measures in place. In other words, we do not envisage returning to a situation as severe as the first lockdown imposed back in late March. And I hope that helps to reinforce an important point. We are not back at square one. We have made progress in tackling the virus, and we have more tools now at our disposal to help control it. And today's framework will help us, I hope, to make further progress. I can also confirm that our objective at all levels is, as far as possible, to keep schools open, though with necessary safety measures in place. That is, in our view, in the best interests of children and young people. So that is a summary of the proposed levels. You can read the detail online, and we will consult with stakeholders and make any necessary amendments ahead of Parliament debating it on Tuesday. Before I move on to my next point, though, I want to say something directly to people who were shielding up until the end of July. Anyone who was shielding should, as a minimum, follow the guidance we provide for the general population. That in itself offers a substantial degree of protection. But today's publication also provides additional advice for each level of restrictions, for activities like going to work, school, shopping and having contact with others. You will find this in the framework document itself, and the Chief Medical Officer will be sending you a letter today. You can follow this advice to the letter if you want to. However, if you want to understand the evidence and take more informed decisions, we will shortly be publishing a guide to help you do that. And if you need practical assistance, remember that the National Helpline remains open for advice and support. The number is 0800 111 4000. We know how hard the last few months have been for everybody, but particularly for those in the shielding category. So we are determined to give you the advice and support you need to stay safe and well. Now, for all of us, including those in the shielding category, our aim must be to live with this virus under the fewest restrictions possible. We want to get to and then stay at level 0 or level 1 of the framework. And the good news, which we should all hold on to, is that we know this is possible because we got there back in the summer. It depends on all of us following all of the rules and advice and doing all that is asked of us. But it also depends on government putting all of the right supporting systems in place. So as well as setting out the levels of intervention, the strategic framework sets out how we will support compliance with facts and other rules. This includes support for self-isolation, which is a crucial part of Test and Protect. We also set out our further planned increases to testing capacity. Before the end of this year, we will have capacity in Scotland to do at least 65,000 tests every day. Some of the increase in capacity will come from the UK-wide Lighthouse laboratory system, but most of it will be in the NHS Scotland laboratory system. We've also published a paper today with recommendations from our clinical advisors on the best use of this extra capacity. Our top priority must always be ensuring that we can quickly test people with COVID-like symptoms, and we know that demand for that will increase over the winter period. Beyond that, our clinical advice is telling us to focus on protecting those most at risk from COVID. We already do regular testing of care home workers, but I can confirm that we will move now to introduce regular testing of designated visitors to care homes, to NHS staff who visit care homes, to care at home workers and to anyone who is admitted to hospital in an emergency. This is an approach designed to reduce the risk of COVID spreading in the settings where we know it can do most harm. However, we will also extend testing of asymptomatic people for surveillance purposes and to help manage outbreaks.